Okay, good morning, everybody. I'd like to welcome everybody viewing and joining us this morning. I will now call this meeting of the Standing Committee on Accountability and Oversight to order. Just so everybody knows, my name is Steve Norn, and I'm the MLA for Trinidad Willowdale, and I'm also the chair of the committee. Today, members of the committee are joining us by phone and by video while they continue to physically distance themselves to help reduce the spread of COVID-19. Today's meeting is being broadcast and live streamed. Committee will be hearing from witnesses about the public health response to COVID-19, including the Minister of Health of Social Services, the Honorary Diane Tom, and the Chief Public Health Officer, Dr. Kandola. Our first order of business is to open our meeting with a prayer. And with that, I'll ask MLA Green to offer the prayer. The line is yours, MLA Green. We're just having some technical difficulties. Stand by.
Chair, if you want, I can do a prayer, Jackson. Here.
Yes, Mr. Emily Lafferty, the line is yours.
Mr. Chair. Since the sun in the Korean chief did make it the AOC committee, it's only MLAs. That do as a public issue that the whole COVID-19 to deal that won't get to that deal the negotiate how we so shrink the whole that and want the issue keep the other in the wrong. Mr. Shuttle, the need to help that did that do not that when it's on do not go to the you know go to do that you keep a sound to have all you but it's a lot of that I think that would be that massive.
Mr. Cho, Emily Rafferty. Going back to our agenda. Next item is review and adoption agenda. Our clerk, Mr. Rutland.
Thank you.
Thank you.
Thank you, Mr. Chair. So today's agenda, we do have a public briefing from the Minister of Health and the Chief Public Health Officer, and then we have a number of in-camera matters relating to committee business the committee will resume with. After that, that includes...
Mr. Chair, it's hard to hear Glenn, maybe speaking from away from the speaker.
Okay. Mr. Cho, we'll give that a try again.
Mr. Lafferty, is that better?
That's much better.
Okay, thank you. So for today's meeting, we do have the public briefing with the Minister of Health, Chief Public Health Officer, and other officials. Following that, committee will be also have a number of in-camera items, including some further discussion with the Chief Public Health Officer, some correspondence relating to upcoming briefings, correspondence regarding regulatory changes from the Minister of Finance. I believe those are all the items on the agenda. I'll just double check. Sorry, Mr. Chair, just one moment. And then there's also a review of an internal briefing note that was prepared for committee regarding mines and oil and gas compliance with Chief Public Health orders. Okay. Thank you, Mr. Chair.
Mr. Cho, Mr. Rutland. Are there any additions or changes to the agenda? Okay, hearing no change to the agenda, can I have a motion to approve the agenda as presented? Mr. O'Reilly has added, has not added anything, so right now we could move ahead with the agenda.
I can, I'm at AOC.
Thank you, Ms. Green. So the motion is been carried. Having reviewed and adopted the agenda, are there any declarations of conflict of interest? I do not hear any. And we'll move on to our first public matter. Our witness will join us shortly, or may have joined us already, Dr. Kandola and Minister Tom. Dr. Kandola, Minister Tom, are you on the line?
Can you hear us?
Yes.
Okay.
Okay, so we see Minister Tom and Minister Kandola.
No, Dr. Kandola. And then
sorry.
Minister Sun.
Yeah, sorry, Dr. Kandola.
I need it on, guys. Thanks.
Okay, and we have. All right. It looks like we do have everyone up and going.
Yeah. Okay, with that, thank you for joining us. Good morning, Minister Tom and Dr. Kandola. And before you're beginning your opening remarks, I'd like to discuss how this meeting will proceed. All comments and questions and remarks will be directed to me as the chair, and both members and witnesses will need to wait to be recognized by the chair before speaking. This process is required to allow the committee clerk to turn on and off the people's microphones. And with that, Minister Tom, the floor is yours.
Good morning, Mr. Chair, and thank you. We appreciate the opportunity to speak to committee today on our public health orders and the path forward as we respond to this pandemic. With me today as technical expertise are Northwest Territories Chief Public Health Officer, Dr. Kandola, Deputy Minister for Health and Social Services, Bruce Cooper, and on the line with us is Dr. Sarah Cook from the Northwest Territories Health and Social Services Authority. Since declaring a public health emergency on March the 18th, Dr. Kandola has taken swift, decisive measures to protect public health here in the Northwest Territories. These measures have resulted in our territory being one of the few jurisdictions across the globe to get a chance at containment of COVID-19. As Dr. Kandola has said, we've only got one shot at this. And to make the shot, we need to get ahead of the game. So far, that's what we've done. I'm very pleased to learn that all of our initial cases are recovered. But Mr. Chair, we know that cases across Canada, and especially our neighbors to the south in British Columbia and Alberta, continue to face community spread and that have not gotten to containment. Today, Dr. Kandola will outline why, in spite of our recent recoveries, it is not yet time to ease these measures that we have currently in place. Because it's these measures protecting us from the surges in our hospitals, which could threaten our communities and put vulnerable folks like elders and those with pre-existing conditions in trouble. And it's with these measures which mitigate the second and third waves of COVID-19, which most experts believe will happen before we get a vaccine. But we also know these restrictions cannot last forever. To that end, Dr. Kandola will also provide insight on what kinds of events could trigger a look at re-evaluating the restrictions that we currently have in place. We are fortunate to be in a position where containment is still possible. Certain we would not be in that position if we not taken the actions that we have. In closing, I would like to recognize the incredible work that's been done by our public health team, our frontline staff, to prevent, to test, to trace, and respond to each of the cases we've experienced, and guiding every person thus far who has recovered. With committee's permission, Dr. Kandola will now provide a brief presentation. Thank you, Mr. Chair.
Masicho, Minister Tom, we'll now hear from Dr. Kandola. Dr. Kandola, the line is yours.
Thank you. So for the next 10 minutes, I'm going to provide a review of the following items. The first one, I'll do a review of orders. Second one, I will talk about managing remaining public health risks. And then the third and last item will be next steps. Before I begin, just want to know if my voice is projected and if people can hear me clearly. So I see nods. Okay. First order of business is to review the orders in chronological order. So the first order was effective on March 21st, 2020, and it was COVID-19 travel restriction and self-isolation protocol. So on March 21st, when this order came into effect, in Canada we had about 1,328 cases, we had 19 deaths. On April 22nd, when I talk to you, what I can state right now is the number of cases across Canada is 30 times higher than what was in effect on March 21st, and the number of deaths across Canada is 84 times higher than what was in effect March 21st. So when the order was initially put into effect, the authority to allow this order to take place came from the Public Health Act, sections 25 and 33. This order was necessary to reduce the public health risk of COVID-19 spread into the Northwest Territories. What we do know now is that it has already saved us from almost certain community spread. 4 of the 5 COVID cases resulted at the time of the order being put into place. And because of the order, all 4 cases went into mandatory self-isolation. This is in stark contrast with the first case where I only had a public health recommendation around self-monitoring. If you came from other parts of Canada, I didn't have an order on mandatory self-isolation. The first case resulted in 70 contacts and 17 symptomatic contacts. Luckily, they tested negative and we had no sequela. But with the 4 of the 5 remaining, because of the mandatory self-isolation, exposure to the disease was at a minimum to almost 0. So the requirement of this self-isolation line does strengthen the ability to assess the compliance and enforcement response level if someone not comply with the self-isolation requirement. And the order will remain in effect until the number of cases and risk of exposure across Canada and internationally significantly drops if we flatten the curve. The curve needs to be flat everywhere for us to be able to lift this order. And this could take weeks to months. There is also the expectation of a second and third wave of COVID outbreak, and that will occur before a vaccine or effective antivirals are widely distributed. The second order relates to COVID-19 directed at the mineral and petroleum industry, and this order came into effect on April 10, 2020. This order gets its authority from the Public Health Act, sections 25. This order is necessary to reduce the public health risk of COVID spread into NWT by closed count work sites where the likelihood of spread could be high if proper measures are not taken. And we can all point to Curl Lake as an example of what we wanted to ensure wouldn't happen here. We worked extensively with the mines and oil and gas companies even before the order came into effect to ensure workplace safety measures were being put into place to reduce the likelihood of an outbreak. We are confident the public health risk is well managed at NWT remote work sites. We have provided testing swabs to these companies so they can test on site. We're sharing with these companies the same clinical advice we share with all our frontline healthcare providers. And we received this advice from the Federal, Provincial, Territorial Committee of Chief Medical Health Officers across Canada. We expect this order to stay in effect for as long as the travel restriction and self-isolation protocol order is in effect. The third order relates to COVID-19 prohibition of gatherings and closure of certain businesses. And this order came into effect April 11, 2020 on the Easter weekend. This order gets its authority from Public Health Act Sections 11 and 25. And this order was necessary to ensure, should we have a person who does not stay in self-isolation and later turns out to be COVID-19 positive, or should COVID-19 otherwise get into our communities, that the spread can be reduced or limited and managed. We could not wait till we had confirmation of community spread before issuing this order, as by then the genie would be out of the bottle and it would be too late. Our health system has limited ability to respond should we have a community outbreak here. We are doing all that we can to prepare, but the best management of a pandemic is not to recover after an outbreak begins, but to do all you can to stop that outbreak from occurring. With this order in place, if we have one case that gets missed or one asymptomatic flight crew member comes into town and exposes others, we would still have substantially reduced the public health risk. We would have avoided a super spreader event. The fourth order that will come into play is the amended COVID travel restriction self-isolation protocol. And this order will come into effect later this week. It gets the Public Health Act Sections 25 and 33. These amendments will add compliance requirements for essential service workers, those supporting essential service workers, those working on public construction projects, including at the municipal and band level, as well as for corrections officers. These persons are currently largely exempted from our travel restriction requirements under the March 21 version of the order. The additional requirements will make it clear that when these classes of people enter the Northwest Territories, they are not free from taking necessary measures similar to those who are required to take to reduce the public health risk of the spread of COVID-19. We recognize that by the nature of the work, essential service workers and others in this category may not be able to wait 2 weeks to self-isolate before starting work. In order to manage the continued public health risk, these persons will be required to self-isolate, but we recognize in instances where that is not possible, the order will set out that the CPHO can grant the permission to work immediately, and in this scenario, additional measures will be necessary, such as the use of personal protective equipment, social distancing, self-isolating while not working, and repeated check-ins with Protect and WT to ensure the worker is symptom-free. We expect this order to stay in effect for as long as the travel restriction and self-isolation protocol order stays in effect. So the next item relates to managing remaining public health risks. And this relates to border issues, day trips, border control, data collection, and track exemptions. NWT were to comply perfectly with the orders in place at this time, there are still ways that COVID-19 could enter the NWT and potentially lead to community spread. We are addressing these remaining public health risks at this time through the Compliance and Enforcement Task Force. This task force is working with our GNWT community partners and through public awareness. One area of concern is continued cases brought to our attention of NWT residents going across the border to BC for the day to visit relatives in Port Nessa, where COVID-19 has occurred in that community. We are also receiving complaints that these NWT residents are not then self-isolating for 14 days upon their return to NWT, as is required by the travel restriction and self-isolation protocol order. We also see instances of individuals trying to drive across the border to go hunting and then indicating that they're exempt from self-isolating because of the traditional harvesting rights exemption. However, the intent of that exemption is to cover those already out on the land, participating in traditional harvesting activities when they happen to wander across the border and back again. We need to improve our controls at the border, especially airports, as well as data tracking to ensure compliance with the travel restriction self-isolation protocol. If we are to know that we've successfully reduced the likelihood of COVID-19 entering NWT. We have identified gaps and are actively working to fill these gaps. Since March 21st, border intake officers have been tracking all NWT residents entering in order to ensure there's proper follow-up occurring, including the completion of self-isolation plans. Since that order came into effect, there is now new evidence available that asymptomatic spread of COVID-19 is occurring at far greater rates than previously thought across the world. This means our measures in the March 21st order to have persons such as flight crews and long-haul truckers self-monitor for symptoms and not enter the NWT, if that is the case, may not be enough to reduce the risk of COVID-19 entering the NWT. Because of this, we are now going to be asking our border intake officers to track all persons coming into the NWT, including long-haul truckers, flight crews, essential service workers, and mining, petroleum, resource industry workers. Border intake officers will simply collect their name and contact information. This information will be used to complete contact tracing and reduce the risk of a large community spread should we get evidence of asymptomatic cases in the NWT. If the above remaining public health risks can be properly addressed and the risk of having COVID-19 enter the NWT be sufficiently reduced, then we can start to think about relaxing measures within the NWT. So in terms of next steps, our next priorities are number one, to address all the remaining public health risks from entering to the NWT, as discussed. Our second priority is increased public health surveillance, especially given new evidence around asymptomatic spread. We have expanded our criteria for self-monitoring for testing to include more symptoms. Anyone with the following symptoms will now be asked to self-isolate and get tested. So the initial symptoms were fever, new or worsening cough, shortness of breath, and then we added 2 or more of the following: tiredness, muscle ache, sore throat, runny nose, headache, diarrhea, vomiting, loss of smell. In the coming 2 weeks, we hope to gather more data as a result of this increased testing to confirm we do not have community spread in the NWT. And in another 3 to 4 weeks, we hope to have access to 2 forms of rapid tests in the NWT. One where we can have results within an hour, and one which we can be taken at any location and processed with results in the same day. So if 1, we have access to faster testing, 2, coupled with strong public health surveillance carried out in the next 2 weeks that confirms there is no community spread in the NWT already, and 3, if we have addressed all remaining risks of COVID-19 coming into NWT, then we can think about relaxing measures within the Northwest Territories. Thank you.
Let's see, Dr. Kandola. We'll now do a round of questions, and to the members, we'll do 1 question and 1 follow-up question to each member. And just to keep your dialogue brief, please, and just to keep things moving along. And with that, I will turn the line over to MLA Lafferty. The line is yours.
Merci, Mr. Chair. Merci through the presentation. Great information. I'm glad things are running as smooth as possible. Mr. Chair, I'd just like to ask a question on workplace safety, part of the presentation. As you know, I have a lot of constituents that are working at the mine site, and we know that the Dominion shut down, but just for care maintenance now. But the 2 weeks isolation prior to returning to mine site, I'm just wondering, how is that being monitored? Is that are their papers being signed off by certain officers before entering the mine site? We know that Divik has a 2-week rotation, and De Beers have 4 weeks rotation. And just wondered, because I have constituents that are coming to me asking those questions, because we have a lot of Southerners still working at the mine site. Are they being tested at the site when they arrive from south? And so those are questions that are being thrown at me, so I'd like to get some clarification from either the Dr. Kandola or Minister herself. Mr. Chair, merci.
Merci, MLA Lafferty. Dr. Kandola, would you like to take that question?
Thank you, MLA Lafferty. On our website, we have available the actual order directed to the mine and petroleum industry. And if you were to open that order in the back, we actually have a specific social distancing protocol that's part of the order. It's not self-isolation, it's social distancing, and it has a self-monitoring component from day 1 to 14. So if, when we had talked about self-isolation would have a monitor going in 2 weeks and 2 weeks off, would be at home, but wouldn't be able to be with their family, hug their child, or engage with them in any way. And so that was a bit too restrictive. So the social distancing allows a risk reduction before they start the 14-day shift, but it also includes a daily monitoring of symptoms, including the requirement to have a thermometer and take the temperature and have it recorded. This 14-day protocol is then handed into the occupational health safety officer, and they're screened again at the time of entry before they go on the flight. So if there's any deviances, if there's any minor symptoms, including the family members, they're to call a healthcare provider within their jurisdiction, and they're also required to call their supervisor. So this is a risk reduction, reducing the risk prior. And the other issue we addressed was if they did everything right, they've done these 2 weeks of social distancing, they're limiting their contact through the public by limiting going to the grocery store or limiting any way they can interface with the public. The other addition is about on the transition going into the mines or the oil and gas is try to use a private vehicle and wear a non-medical mask so that they don't get re-exposed in the transition. When we talk to the mines a lot and oil and gas, they also have direct charters coming in so that to avoid as much as possible, to get most of the civil work as much as possible to be going directly to a charter flight and then going right to the mines. Where it's not possible, and those workers that have to take a commercial airline to get to that charter, they're requiring this additional safety requirements around private vehicle, wearing a non-medical mask, if you can't socially distance, washing their hands frequently.
Okay. Let's see, show Dr. Kandola a follow-up, Emily Lafferty.
Mr. Chair. Mr. Chair, just quickly, if there are symptoms, those individuals showing symptoms are not allowed back at the site. Am I correct?
Thank you, Ms. Emily Lafferty. Dr. Kandola.
Yes, you are absolutely correct. And if you review the social distancing protocol, it's very clearly laid out. And if you look at the self-monitoring section, it's pretty clear exactly all the symptoms they have to check off. And if they are symptomatic, they're required to call their healthcare provider and their supervisor.
Dr. Kandola. Thank you. Up next, I have Emily Bonnerouge. Emily Bonnerouge, the line is yours.
Mr. Chair. Thank you to Tammy and Diane and Bruce Cooper and Sandy Cook for appearing before AOC. COVID-19, also known as the coronavirus, was declared a pandemic by the World Health Organization on March 11, 2020. The GWT has since declared a state of emergency and implemented strict public health measures, including the closing down of borders and border checkpoints, thus limiting travel into the territories from other regions. From the limited number of COVID-19 cases, 5 at the most, and all are cured, this has very much flattened the curve on the virus in the Northwest Territories, a commendable job operation by all involved. Today marks the 6th week of the coronavirus pandemic, and the need for self-isolations, physical distancing, and a host of other measures that the people of the Northwest Territories have had to adhere to. Many are content, many have expressed frustrations, and they all want to know if there is an end in sight. There are speculations that there is no foreseeable end to this virus until such time as a cure has been found, which could take another 12 months or more. Has this discussion taken place? And what can you tell to the residents of the Northwest Territories as to a timeline? Masi.
Merci, Amalay Bonarouge, Dr. Kandola.
Thank you to Emily Bonarouge for an excellent question. So what, if we were to get, if Canada was to completely lift up all public health measures, it would be because we have effective vaccine or antiviral therapy available. And if you look across Canada, that's not in sight, and the timeline, as you correctly state, could be 12 to 18 months. Does that mean that NWT will be in complete lockdown for the next 12 to 18 months? That's not my intention. So our intention is, our cases were travel related, we're in containment mode. We were one of the few to implement very aggressive measures to ensure that it's still, we can have mandatory self-isolation for imported cases that there would not be community spread. There are a number of prerequisites we need to have in place, but we could have been one of the first to implement aggressive measures, but we could also be one of the first to start relaxing public health measures in a phased approach. And the first approach is we need to tighten border security. Because one of the data that I said in the beginning was that on March 21st and on April 22nd, the scenario is different. On April 22nd, we have 30 times more cases of COVID-19 occurring in the rest of Canada. We have 84 times the amount of deaths occurring in the rest of Canada. On average, we have 1,500 cases per day occurring in Canada, and we have about 100 to 150 deaths occurring per day. So I can confidently say that from March 21st to April 22nd, our travel risk has increased. That people coming into NWT are in a different situation than when the order was in effect. So the main focus is, while we wait for the rest of Canada to flatten their curve, while we wait for them to be able to get into a state where they can relax public health measures, can we tighten up border security to the point that we can have greater freedom within NWT? And part of tightening up the border security are some of the orders that we've been putting into place around those who were initially exempted, is to have a greater access to their compliance with the workplace risk assessment, and that ensuring that they're self-isolating when they're off shift. In addition to continue to ensure compliance with our returning travelers. So if we have tighter border security, and which we will do, and plug in all the holes, that's one prerequisite. The second is we have close to that 1,593 tests today, and only 5 have been positive. We've had tests from every single community, and this is a really positive indication that we're not seeing community spread. These are tests done on people who are symptomatic, who meet the symptomatic criteria. And even though we've opened it up for softer symptoms, if you were to look at the data, people fall in that category are less and less every day because we're exiting flu season. And so people who are not necessarily, who are symptomatic, we're not going to be getting as many tests. So we thought developing a proactive community surveillance project so that if people have very mild symptoms, not enough to flag to a healthcare worker, if they have no symptoms, that we're proactively have a community center project where we're looking at, we have a pulse on the communities and seeing what the data shows. And I'm confident the data would continue to show we have no community spread. So we have if we have type border security where our real risk is, and we've shown that the real risk is still travel and that it's not spreading quietly in NWT, then the third measure will be in a phased approach. We can start lifting up public health measures. We can start opening up businesses. There's opening up non-essential businesses provided they have good infection prevention control measures in place and they have good workplace risk assessments and they can ensure people are socially distancing. We can open up those businesses and then actually, when you look at my order, what we said for that particular non-essential business is that if you can do these measures, you can go ahead and open. So they have that freedom now. There's another class of non-essential businesses that we feel in the near future that we could allow to return. And we're looking at businesses where they can't maintain social distancing. And these are largely personal service established businesses, nail salons, massage, car practitioners, hair salons. And we feel that if we have strong indication that there's no spread here and we have tight control of the border, and if they have the appropriate infection prevention controls and the appropriate personal protective equipment and have a good workplace risk assessment and are dealing with clients one-on-one, the relative risk of opening them up would be minimal. In my world, pretend I'm a SARS-CoV-2 virus. You have to, a lot of people are looking at this outbreak like there's no cases, let's just relax all measures. But you have to understand SARS-CoV-2 virus is a stealth virus. It is not the SARS virus that we dealt with in Canada about 16 years ago, and it's not the MERS-CoV virus that we see in the Middle East. It's not that type of coronavirus. Those viruses, they got worse. So if you were symptomatic with that virus, the longer you had it, the more you could spread. And you typically can only spread when you're symptomatic. And so those viruses, they peaked, the SARS virus peaked and it basically extinguished itself. SARS-CoV-2 is a very insidious stealth virus. So basically, what we're seeing with the data is that you can actually spread the virus 48 hours before you even develop symptoms. So that's what the data is showing, and CDC is saying 1 in 4 could be asymptomatic. We also know with this virus, the greatest risk of spread is early on, and we also know that when people could have relatively mild symptoms and still spread it. So if you're that SARS-CoV-2 virus, how do we stop you from infecting many people? And that's going to be physical distancing, maintaining a space of 6 feet. And so that's going to be the underlying principle when we go into different phases of public health measures is how, if we did get someone with SARS-CoV-2, how many people could they infect? What are super spreader events? And so when you look at it that point of view, there's some measures we can relax, but there's some measures that will be later, such as mass gatherings, especially gatherings. If you're a SARS-CoV-2 virus, you would jump for joy to get into a mass gathering where there's no physical distancing and you could potentially infect many people. And I'll end with this. All you need is one funeral in Newfoundland and you can cause an outbreak where you can't put the genie back in the bottle. It just takes one funeral.
Masicho, Dr. Kandola. Follow-up. Emily Bonner, mine's yours.
Yes, thank you for your statements there. It's quite a bit to fathom. You're mentioning opening up some businesses. I don't know. I must have missed a lot of the orders, but I will look into them. I'm just wondering. as we keep extending the state of emergency a week at a time, it seems like that's the norm now. Can you determine a long-term plan, like to let all employees or the people of the Northwest Territories know? Like, you're not going to be going back to work, nothing's going to be back to normal. The normality of life as we have known it. To say, okay, well, we can extend this to June and then work from there, rather than the week-on-week extensions. Muffy.
Emily Bonnerouge, Dr. Kandola.
So just to clarify, under the Public Health Act, I can make a recommendation to the minister to extend the state of public health emergency 2 weeks at a time. That state of public health emergency allows the border restrictions. If I lift the state of public health emergency, basically, the scenario that I played before is that people can come through the border with travel-related risk, and there's going to be no means to monitor or track them. And I hope with the data that I provided to let you know that that would not be a wise move to do right now, because we're 30 times more cases and we're 84 more times deaths the rest of Canada. Around when do we lift the public health measures? We're engaging with all the chief medical health officers across Canada. We're engaging with the chief public health officer, Dr. Teresa Tam, and through the special advisory committee. And she has talked about a phased approach and a transitioning. The rest of Canada are not at where we are. I feel that in NWT we're closer at looking at relaxing measures. This is what we're with the requirements I said before. However, we will be working with the rest of Canada when we realize that we can lift up all public health measures and this ends, and we turn into a state of new normal. But from what I can tell, that would be when you have a vaccine and antiviral, effective antiviral that will be available. We're not there yet.
Masito, Dr. Kandola. Up next, I have Emily Johnson. Emily Johnson, line is yours.
Thank you, Mr. Chair. Thank you to all the staff for presenting today. I guess one of my concerns here is that I'm happy that we keep hearing references to data and that the decisions are being made based on that. But to this date, we've seen no data released for the Northwest Territories, nor do we have any access to that. And I guess I'm a little concerned that we've gone this far into the situation, and I have no sense of what the real risk is. So we must have a sense, based on 45,000 people in the Northwest Territories and the relative mortality rate of COVID, like, what's the worst case scenario? How many deaths would we see on 45,000 people with community spread? Or do we have data that factors in the fact that we have very high rates of respiratory illnesses? I've never seen any of that information, and so I'd like to get a sense of what the worst case scenario is here on a basic analysis of the mortality rate on 45,000 people, because that's not information I could ever put together as a politician. Thank you, Mr. Chair.
Thank you, Emily Johnson. Dr. Kandola.
If Emily Johnson has a calculator, I can help him calculate. So, if you do the calculation, 44,000, moderately we go between, let's say you have no measures at all, between 30 to 70% of the population can be infected with COVID-19. You can calculate that number, like the lowest at 30%, the highest at 70%. You can have a range, and within that range, 80% will be mild and won't require hospitalization. So you can calculate 80% of 30%, 70%, and then with the remaining amount of that population, you can do 20% be hospitalized. So they will require hospitalization, and of the 20%, 1 out of 4 would likely require intensive care unit. And we only have 5 cases. Our 5 cases follow that perfectly. 4 out of 5 were asymptomatic, were mild and recovered without requiring hospitalization. A 1 out of 5 required hospitalization.
Dr. Kandola. Just a reminder, all members, make sure you mute your mics, please, when you are not speaking. Thank you. Follow-up question, Molly Johnson.
Thank you, Mr. Chair. I tried to follow that math on there, and I did not get to any sort of capability to do that. I'll try later. I guess perhaps maybe I've seen the justification for why we're not releasing modeling, and I get that. We don't want to release inaccurate modeling, but I think some more information could be provided. I guess could I get the math that was just presented to me to be provided and actually written out? Thank you, Mr. Chair.
Thank you, Emily Johnson. Dr. Kandola.
That calculation. Do you want me to do it right now?
Yeah, my apologies, Dr. Kandola. Can you just repeat that last part?
No, I don't.
Dr. Kandola, the line's yours.
Hello? Can you hear me?
Yes, we can.
Okay. So we can provide Emily Johnson that calculation. One of the, when you look at modeling across, there's only 4 jurisdictions in Canada that's in the containment phase. It's Yukon, NWT, Nunavut, and PEI. All the other jurisdictions, they can get to very robust modeling because they can have 100 cases. When you get up to 100 cases, you can do some kind of projection. But when you're doing modeling, when you've only had 5 travel-related cases with no community spread, it's not very robust. We, the 30 to 70% calculation has been modeling that's been provided by experts in epidemiology, so that is what we can use. The other thing, he had talked about mortality rate. So mortality rate is an interesting, it's a moving target. The true mortality rate we'll know after all this is done, where we can actually see how many people were asymptomatic for antibody testing, and that will make the denominator a lot larger. So right now, estimates around mortality rate can range between 3.4 to about 4%, and it really changes by jurisdiction. So that mortality rate is based on the number of deaths we have and the number of confirmed cases on the denominator. But the struggle we have is that across Canada, we don't test. We're not testing everyone who has COVID-19, and there's a lot of mild and asymptomatic individuals who are not being tested. And so at the end of the day, our mortality rate will only be diluted. It will be less because the bottom denominator would increase, because then we'll figure out, wow, we actually had more people who had COVID-19 than we thought. We have all these antibodies, and all I can tell you is the current mortality we have, it will be less once this is all done.
Thank you, Dr. Kandola. Going back to my queue. Up next, I have Emily Semler. The line is yours.
Yeah, so clearly we've contained the virus, and now the questions are being asked, and civil liberties are saying all these different concerns that, you know, were very vague, and the decisions. And I know your presentation, you did fill in a lot of the gaps by saying that. One of the questions that I really keep hearing from people is, what do we need to be at so what you did say it, but where do we need to be to start, alleviating some of the restrictions? And we need that in writing so that we're able to share this with our constituents, with the people that are contacting us, because we're part of your team. We're helping getting the message out. People are coming to us as well, and we need to be able to share this information on, so that way we don't have another 2-3 weeks and, you know, everybody's starting to get, like I say, cabin fever and restless and are starting to question everything. You know, there's a lot of people at home, staying at home, sitting, a lot of thinking going on. So I really want to know the department is working on that clear messaging so that we can be provided it, so that, you know, it's easy for us in plain language to just say, we're at this level, these are the orders, these are the reasons why. In order to move down, lessen those restrictions, can we put something like that? Thank you.
Thank you, Emily Sumler. Dr. Kandola, line's yours.
So on Sunday, for the Special Advisory Committee, this is a question not only being asked within NWT, it's being asked across Canada. And so there is a document that we're working, there's a document that was prepared about different phases of transition from our current phase to phase 1, phase 2, phase 3. Phase 3 would be when we actually have an antiviral or a vaccine available. And phase 2 is about relaxing measures where we can maintain infection prevention control or PPE or social distancing in some cases. This is a lighter relaxing where if you did have a COVID-19, the impact of spreading it will be minimized. Phase 2 is a lot. It's a wider opening of those measures. So this document will be presented to the ministers, and it will give the clarity that MLA Semler is looking for. It's very detailed, and it'll give you in all the different scenarios of what measures would be taken and at what phase. And so it was just introduced on Sunday, and we're looking at that document, and we're, like I said, we're tidying up our borders and looking at community surveillance, so that, because we want to be the first, one of the first jurisdictions to move into phase 1.
Thank you, Dr. Kandola. Follow-up question, Emily Sumler.
Yes. So I know that it's been mentioned, and the 1-hour testing, we did talk to it a little bit. So when can we expect this 1-hour test to be on the ground and being used in the territory, knowing that we could start to do more real-time contact tracing if we were to get cases? And is this a tool, is this something that's going to be part of the decision-making and releasing restrictions if we get this tool? Thank you.
Thank you, Emily Sumler. Dr. Kandola, line's yours.
I can actually, Dr. Cook can answer around the testing part, and I can talk about the decision tool.
Thank you, Dr. Kandola. Can you hear me?
Thank you. Yes, Dr. Cook, the line is yours.
Thank you. Thanks for the question. So there are 2 technologies that are on order and hopefully will arrive soon. The first we expect to receive is the Gene Expert, which is a machine that needs to be at Stanton because it requires a higher level of lab staffing and technology to run. We're hoping to have that shortly. We think that it's going to be up and running within the next 2 to 3 weeks, but I can't give you an exact timeline because it's actually not on the ground yet. So it needs to arrive, and then we need to do the validation, and then we need to do the training. But we're really excited to have that on the ground because it certainly is going to change the way that we're managing this, because we'll be able to have those results much faster. The other one that you've probably heard about is called the Spartan Bioscience Cube. Those are also on order. They also have not yet arrived. The plan is for those to be in regional hubs, so in Newbeck, Hay River, Portsmouth, and also at Stanton. But there is information that we're still waiting for from the company about the materials that are required, the reagent, the chemicals that are actually required to perform the test. There's still some missing information, so we're not as confident about the timeline for that one as we are for the Gene Expert.
Thank you for that response, Dr. Cook. Dr. Kandola, line's yours.
So having this rapid turnaround test, like with the gene export, we can collect samples and we can get results hopefully within 24 hours. The Spartan Bio, it's a lot more complicated. You need to actually be there, and it takes an hour, and you need to get it tested within minutes of taking the sample. So there are two different ways of testing, but both methods will be a lot faster than sending it down to Prob Lab, where we have a 4 to 7 day turnaround. However, for us to use that as a decision-making tool, we need to have lots of test media. And so right now, one of the rate-limiting steps is we only have we have a limited number for the gene expert, and so that type of testing will be ideal if we want to discharge someone from the hospital who's clinically improved and we need the space. We can do that test in about 24 to 36 hours, and instead of waiting 4 to 7 days. So that would be good. If we get ability to ramp up our testing, that would allow us to be more proactive around screening at the border, but we're not there yet. However, one of the misconceptions people have is just because you've come in for screening and you test negative, it doesn't mean that you don't isolate for 14 days, because we do know the incubation period of coronavirus can be up to 14 days. It's just that if we do use that test for screening purposes, especially for people working with high-risk populations like healthcare workers or people working with homeless or other high-risk situation at the border, it just is that added risk reduction strategy, but there still has to be 14 days of self-isolation or self-monitoring.
Thank you, Dr. Kandola. And up next, I have Emily Jacobson. Just before I get to Emily Jacobson, just to let you know the order of members. So after that, we'll have Emily Simpson, then Emily Marcellos. Emily Jacobson, the line is yours.
Yeah, thank you, Mr. Chair. Good morning, everyone. Just a quick question, Tammy, on the regards to the Canadian North flight that's traveling up here. What time are, like you say, stage 2 or stage 3 of this COVID-19? Are the airline, have they reached out to you yet in regards to, are they going to start doing more flights into Inuvik? And thank you.
Thank you, Emily Jacobson. Dr. Kandola?
And that's a question I can't answer. I would have to defer it to we can get in touch, with ITI. I don't control the airlines, unfortunately, but what is good is that because of Transport Canada, it's mandatory everybody wear a mask on those flights, so that's an additional risk reduction measure that government and federal government has put in place. But how often they fly in and out, that's more directed to ITI.
Okay. Thank you, Dr. Kandola. Follow-up, Emily Jacobson.
Yeah, thank you, Mr. Chair. No, just in regards to the airlines like in the Beaufort Delta, ACLAC there, and Canadian North, because they're going on either side of Ulukaktuk. If their masks are if the masks are required now in the airlines through Transport Canada, I guess the frequent in between flights, that's just a question I have in regards to where they're at. I know ITI is the one that basically that the airlines are going off of in regards to the funding that they're short because of non-passenger revenue. So I guess we just need and another question, a clear and concise timeline, what Lisa said, like in regards to getting it out to our constituents, because, all we've been doing lately is putting out the numbers, and I know I'm happy with the 5 that recovered and stuff like that, but the second and third wave, I think it should be put out there in regards to letting the public know of what's happening with COVID-19. Thank you. A lot of comments. Thank you.
Thank you, Emily Jacobson. Comment, Dr. Kandola.
So The transition plan was proposed on Sunday. Today is Wednesday. It has to be finalized, but once it's finalized and be made available publicly, we can share that. Again, with their airline, I don't have control over their airlines, unfortunately.
Thank you, Dr. Kandola. Up next, I have Emily Simpson. Emily Simpson, the line is yours.
Thank you, Mr. Chair. I would just like to say, I guess I'm pleased with the action and in the work that the Department of Health is doing with respect to COVID-19, and I think the residents are pleased as well. But I guess the question the concern I have, and it brought up here, and it's to do with elders, I guess, and senior and care facilities. We hear about what's happening in care facilities in southern provinces down south, and the news isn't good coming out of there. And my concern, I guess, is that that we're lucky here in the north that the facilities we have are government run, and that the people that are working there are paid well, and that for the most part they care and they do a good job. But right now, some of the seniors, whether they're in the care facilities or whether they're at home, have really no access to family members except by probably telephone. Some of them may not be well versed in technology, and I'd like to know if the health department is looking at anything to address that. To give an example, in Hay River, we have a number of seniors and other residents at the Woodland Manor and Extended Care. And myself, I wouldn't mind talking to some of them, not just over the phone, but visually. And I'm just wondering if the Department of Health is going to address that, or are they looking at it, or have they considered it? Thank you, Mr. Chair.
Thank you, Emily Simpson. Dr. Kandola, would you like to take that?
So, thank you. I'm going to share some of this with Dr. Cook. But when we first heard about COVID-19, and when we were looking at what was happening in China, we were on February 17th, before we even had cases in NWT, what we did see was an age-related risk related to COVID. So the older you are, and the risk is 60 years and older, that was definitely a risk for severity, for hospitalization, and for mortality. And we saw the same with people with pre-existing medical conditions. So our first intervention was around protection. So the around long-term care facilities was about visitor restriction, about making sure that we don't have a scenario like we've seen in over 1,000 homes across Canada, where you have outbreaks happening in nursing homes, because this is the most vulnerable population. So the first item of business was around protection. The other was developing a social marketing campaign. Some of that was with Hotsi Seda too. It's about how do you do physical distancing and still maintain social connection, trying to balance the aspect of protecting our elders, but not trying to promote creative ways of still being in touch with our elders. So that's what I can say at a larger public health level, but specifically around the long-term care facilities or home care, I will leave that to Dr. Cook to address.
Thank you, Dr. Kandola. Dr. Cook, did you have anything to say to this?
Sure. So just to reiterate Dr. Kandola's message around the vulnerability of this population, it's really important the visitor restrictions have been put in place for protection of a population that we know is vulnerable to COVID-19 and can become very ill very quickly. So the visitor restrictions are in place for good reason, and we're also making sure that the staff are screened and that they're not going to work with any symptoms. The other thing that's important to note around the question of kind of virtual access and virtual visiting, it's an important one, because we certainly don't want our elders to be isolated, we do have our health providers providing a lot of virtual care throughout the territory already, and that includes in long-term care facilities as well. So we have physicians who are providing virtual care and also doing virtual visits with family members to discuss goals of care and discuss what's happening with their family members. So I think it's a good question around, access to technology within long-term care facilities and helping elders to use that technology to have access to their families as well. I know that it is happening in some places, and certainly something that can be encouraged.
Merci, Cho, Dr. Cook. Follow-up question, Emily Simpson.
Thank you, Mr. Chair, and thank you for that answer. Another issue is, I guess, the security at the border. As you're well aware, in South Slave, we have security here. It's not actually at the border. It's at Enterprise, and I think some people didn't realize that. And so we do have a gap there between the border and basically, I guess, kilometer 82 roughly, where there is no security. There may be some patrols throughout the day. As the weather warms and people start to access the falls and for breakup and that, and with no active cases here in the territories now, and the proximity to Alberta, we may see some, not an influx, but we may see some people coming down to fish or whatever. Is there any, I guess, what input would you have in deciding where that border security should be established? Can you say that we'd be better off to have it at the border? I know there's some issues with it, and it's self-service and safety and in that area, I guess, so we got to balance that with the safety of the residents as well. So just if you can comment on that. Thank you.
Merci, Cho, Emily Simpson. Dr. Kandola, the line is yours.
So the border measures are in place at Enterprise. That's the first community people are trying to get through into BT that they encounter. It also has cell phone service, and it's, in terms of our border security, it's an ideal place. They can have ability, if there's any issues around the safety, they can contact people that are in satellite distance. And it's at that Enterprise where we can decide whether people go to Hay River, which is right if they have to self-isolate, or if they continue on to Yellowknife. What we have to realize is that we have provided guidance around outdoor gatherings about being 2 meters apart. So even if we don't control the border Alberta Enterprise, if someone came and went fishing, would they introduce COVID? Like, what's the risk there versus people coming across the border and wanting to live in a community where they have greater interface with people and could potentially spread it if they don't self-isolate. So there's always there's a measure of risk to our security officers not being able to access cell phone services, and then what is the true risk to public if people are not actually in the community and they go fishing and go back across the border. So that's what we have to take into account.
Thank you, Dr. Kandola. Going back to my queue, looks like I have Emily Marcellos. Emily Marcellos, the line is yours.
Did you hear me?
Yes, we can. Go ahead. Yes, we can. Go ahead.
So, Mr. Chair, I thought the presentation was excellent. I'm very proud of the work that has been done by the Department of Health and Social Services and Dr. Kandola. Nowhere across the country except for Nunavut, we can actually say that we have no cases in our area. That is a big, tremendous a job, and I want to extend my wholeheartedly congratulations to the department and to Dr. Kandola. I I know that it's summer, it's coming to summer now, and people are getting antsy and have anxiety, and there are other issues, probably mental issues, issues about moving around a bit. The question that I would have is that how long do you think this will last? Maybe till the end of June, or do you think we'd be able to get back to some normality by the beginning of June, or I would just like to ask that first question.
Thank you, Emily Marcellus. Dr. Kandola, mine's yours.
So we're looking at the next 4 to 6 weeks, and if we do, and that's 4 to 6 weeks of looking at if we're getting any more cases, if there's been any community spread, what our data is, how tight is border security. If we do move to a point where we can relax measures, you have to realize it's going to be a new normal. Until we get the vaccine, no one in Canada is ever going to go back to normal. If normal means having a Folk on the Rock concert, going to see a movie in a crowded theater, or cramming 60 people in a room for only 25, that's not going to happen. But if a new normal means that you can go on the land, you can go camping, you can go get your hair cut, you can go do takeout, these things can happen. We can relax those public health measures. The tighter the border control, the lower we can relax the measures, but we can't go back to a new normal. We can't go back to normal the way we have defined it, where there's mass gatherings with the potential of a super spreader event. We can be one of the first in Canada to start moving to relax our measures, and I'm looking at it based on data, based on at least a 4 to 6 week time frame. When we get the phases of transition, when that becomes official, we can share it with all the MLAs so that you can actually see all the detailed scenarios of phase 1, phase 2, and phase 3. It'll help you understand better how it applies and where we're at.
Thank you, Dr. Kandola. Emily Marcellus, follow-up.
Thank you for that answer. I think that I'm not asking for a normal like we did before this all happened. I'm asking for somewhat normal to ensure that we still have access to haircuts and some of those things. And I still feel that we have to be very cautious, especially with the borders and with who we let in. I think that will always be, it's always going to be in our mind, even after all this is done. You know, we'll always have that sense that we went through this, and I'm sure we'll always be looking over our shoulder, or would be thinking, gee, we went through this thing and it was awful, and now we have to be more cautious. So I just, I really want to thank you for some of the things that we've done with the Northwest Territories, because we have such a small population, and I know if we had 10 cases, someone was comparing that's like, you know, 10 cases could be like 3,000 cases, and hopefully this does not happen, and I look forward to getting over the whole thing in due time, and hopefully a vaccine is found very soon. And I want to thank you on behalf of the people of Tabacha and the Aboriginal people in the communities. Okay, because I was so afraid when we had that one case, and we seem to recover from that, and I'm sure that people are thankful for that. Thank you so much.
Thank you, Emily Marcellus. Dr. Kandola, comments?
I just want to thank Emily Marcellus. Everyone, all of us are anxious to get to a new normal, and it will be phased in. into a phase 1 and phase 2. And like I said, I want NWT to be one of the first people to start moving to phase 1, because I do know this is not, you look across Canada, not everyone have the privilege or the ability to be where we are right now, where we're actually considering moving into phase 1.
Thank you, Dr. Kandola. Up next, I have Emily Green. Emily Green, the line is yours.
Yeah, thank you, Mr. Chair. Mr. Chair, my question is for Dr. Kandola, and I'm seeking some clarification about the compassion and safety guidelines that were issued yesterday. So in the event that a woman wants to attend a family violence shelter in order to seek safety from a domestic violence situation, is she able to do that within the order? Thank you.
Thank you, Emily Green. Dr. Kandola, line is yours.
Absolutely. We need people to feel safe. The intent of the mass gathering order was to allow exemptions for at-risk populations and people fleeing domestic violence. What we're saying is seek help first and do not let this order was not intended to restrict you. You're exempt. We need people fleeing interpersonal violence and their children to seek safety first. That's the most important principle, and we provide that exemption. That's all I can say. Thank you.
Thank you, Dr. Kandola. Emily Green, follow up.
Yeah, thank you for that response. So what I understand is that it's business as usual for the shelters. People may or may not call. They can show up there looking for safety as they would have done 3 months ago or 6 months ago. My next question has to do with reopening the campgrounds. I'm wondering what the risk is to reopening the campgrounds, for example, along the Ingram Trail that are not located near a small community. Because the campgrounds, as you may know, are quite spacious and would enable for family groups to stay together but not to have physical distancing issues with other campers. My concern is that if we don't open the campgrounds, people will freelance camp, and that could lead to real issues with garbage, sewage, and fire pits. Thank you.
Thank you, Emily Green. Dr. Kandola.
I just want to thank Emily Green. She must have read my mind, because I have a meeting with Territorial Park from 12 to 1. Actually, we discussed that issue. What Emily's need to know right from the beginning, when we put in orders, I've always stated and I've always supported people going on the land, people going outdoors. Other jurisdictions have done lockdowns for indoor and outdoor gatherings, and that includes going outside. And I've always been a proponent of going outside, and that includes looking at what is the risk of these campgrounds when they're all spacious. What we would say if we would open campgrounds is that the actual camp, the trailer, or someone's cabin is still considered a home, and we don't recommend indoor gatherings other than the people who live in that household. But outdoor gatherings, the people can physically distance, a quota around accessing other parts of campground. These are things that we want to discuss. We want NWT residents to enjoy the summer. We want them to be outdoors. We will do everything possible to enable to do this safely.
Thank you for that response, Dr. Kandola. Up next, going back to my queue, I have Emily O'Reilly. The line is yours.
Thanks, Mr. Chair. I want to speak to the public health order that's in place for the mineral and petroleum industry. And I guess I want to start with a couple of concerns. Concerned with the length of time that it took for the public health order to get in place. We had the border closure on March 21st, and it wasn't until April the 10th that the order was brought in place. I know that there were some things obviously being discussed behind the scenes and work with at the mines. That's great. But I'm also concerned, and this is more directed at Cabinet and the Minister, about the length of time it's taken to get answers to questions about the implementation of that order. 19 days, that's just far too long to get an answer by email. I'm concerned about the mixing of objectives when I hear public officials talking about economics versus public health when it comes to this sector in particular. And I think it really comes down to fairness and consistency. We have small businesses that have been closed, and we have large sites that get to remain open, and there's inconsistencies between the way that they are dealing with their workers. But I want to move on, Mr. Chair, to the questions that I have in particular. And I'm concerned about the fact that it is a self-reporting system for this particular order, and that there are no inspections taking place at the sites. And I have no reason to believe that safety is not foremost amongst the minds of the people at these sites, the people that operate them, and I've been to them myself. But without inspections, I think there's issues of public confidence, and we've seen that in Alberta with what's happened with the cargo plant and the Curl project. So how are we going to ensure that there's inspection and at these sites to ensure that there's compliance taking place with this particular order? Thanks, Mr. Chair.
Thank you, Emily O'Reilly. It sounds like there's a two-pronged, two-portion part to that question. So, Minister Tom, would you like to take the first part of that question?
Thank you, Mr. Chair. The member's correct. It's never the intent of our cabinet or any ministers to hold information back from any of the MLAs. I think once we get our information from our Chief Public Health Officer, by the time we get the information and we pass it out to the MLAs, it's within hours. And it is, our apologies if it's taken some time. And, the whole idea, the Chief Public Health Officer is a statutory appointment made by myself under the Section 4 of the Public Health Act. And this allows the Chief Public Health Officer to have control of all the events that have been happening with the COVID-19. And, it's an independent position that, Dr. Kandola has taken, and, we rely on her expertise, and, some of the orders that she's put in place, we've seen that's been very positive for the Northwest Territories, and we continue to respect and just really follow along suit with Dr. Kandola's recommendations. Thank you.
Thank you, Minister Tom. Dr. Kandola.
Again, what's unique in WT, because I understand that Emily O'Reilly is comparing us to Alberta. What's unique in NWT is that we actually put an order in place with a whole bunch of compliance, whole bunch of orders that the mines and oil and gas need to comply with. This is unique. The similar orders are not put in, have not been put in place in Alberta. This order allows, myself to have a greater degree of control around risk reduction strategies, compliance, and ability to, if they do have a suspect case, that they have to quarantine and call the CPHO, the Chief Public Health Officer, and follow my instructions. This is a unique situation because this is not what is in place in Alberta. So having a greater degree of control in the private sector and being able to direct their management is an effective strategy to reduce risk. The mines between March 21st and April 10th we were actually working extensively with the mines. They had put in place a number of these procedures. There is a WSCC inspection officer who's been dealing with the mines for a number of years and already has inspections around compliance. How we substituted the direct on-site compliance was a number of pictures, a number of the high degree of information was sent back to WSCC and ourselves to see their compliance. So things that we wanted to look at is the disbanding of self-service buffet. So from both sectors, we were getting individually wrapped meals. We wanted social distancing at the cafeterias, and so we were able to see that. We wanted reduction of staff to essential staff only. We wanted dedicated rooms, no shared accommodations. We put into place a number of requirements that would increase increase physical distancing and reduce spread. And then on top of that, we wanted this monitoring situation 2 weeks prior to allow further risk reduction. So we put in place a number of measures to reduce as much as possible the risk, and the mines themselves are looking at further measures down the road.
Thank you, Dr. Kandola. Follow-up question, Emily O'Reilly. Line is yours.
Thanks, Mr. Chair. Yeah, I want to commend De Beers in particular. He did reach out to me about the implementation of the measures they're taking at the site. He shared the presentations with me. I can see how they developed over time. I think they're doing a very thorough job. But I still have concerns, the fact that we don't have anybody doing independent inspections at the site, or all of these sites. I'm just wondering if there have been any complaints from employees or the unions about implementation of this particular public health order, and what sort of follow-up may have taken place on these. And look, I have no reason to believe that the mines that Norman Wells, Imperial are not committed to doing this work, but we need to have independent verification. Thank you, Mr. Chair.
Thank you, Emily O'Reilly. Dr. Kandola, line is yours.
So, if there was any issues would have been flagged to myself prior to the order, we've sent it to WSCC. And around the inspections, we can bring it back to WSCC. One of their workarounds would be to do an on-site remote inspection where they could pick a day and they could have direct the employer to show them different sites. But that's with the WCC. I can bring that back to them about the concern of not having an on-site inspection. But if they can do remote inspection, which is unplanned, and be able to further check compliance, that would be something that they would be able to do. And the other is in terms of if there's any complaints around mines, that will be directed to WSCC, but nothing has been flagged to me since the order that they've been in breach of the order. And if they were, then additional compliance enforcement task force group that report to me can also ensure compliance. So there's two different avenues, WSCC and my compliance enforcement task force, but I haven't, after the order, I haven't seen any complaints of breaches.
Thank you, Dr. Kandola. Moving back to our queue here, I have Emily Cleveland. Emily Cleveland, the line is yours.
Thank you very much, Mr. Chair. And just to start, I'd like to also reiterate a huge thanks to Dr. Kandola and Dr. Cook and the work they've put into this over the last few months now. I guess my first is more of a comment in regards to the phased mapping that we should expect to see on Friday. There was a comment made that that would be distributed to ministers, and I'm hoping that MLAs will also be receiving that, just because it is void of political influence. So I think it would be great if we can also communicate kind of what tomorrow looks like to our constituents, because that will have a huge impact on our ability to encourage people's emotional and mental sustainability of these orders. My first question, though, is in regards to business owners that are currently not operating. So there are some businesses who are deemed not essential, but them making an income is definitely essential to them being able to support their families. And so I appreciate that Dr. Kandola spoke briefly about working with people down the road in the next phase, maybe, of getting people back to work who can work one-on-one. And I'm wondering if there is a commitment from Dr. Kandola as to when that will happen, and when businesses can expect to work with WSCC and work with Dr. Kandola's office to get them back to work. Thank you.
Thank you, Emily Cleveland. Dr. Kandola, the line is yours.
So there's 3 categories we can look at. We can look at essential businesses, retail stores like grocery stores, gas bars, banks, those are remain open. And then there's the non-essential business where they can maintain 6 feet of physical distancing. And in the mass gathering orders, what we said was all retail businesses not specifically mentioned in paragraphs 2B and C may remain open, provided they are able to comply with the guidelines established by the Chief Public Health Officer. So some of these non-essential businesses, I'm getting a request from non-essential businesses, and we're approving them. We have not turned away any businesses that can maintain physical distancing, that can, it's not just about physical distancing. Some of it's like they're about, some can telework, they can do remote work, they can go down to essential staff, they can reconfigure their business to allow a certain amount of clients to come in. Those businesses, we have no issues of being open even now. The third category that I'm looking at that I want to phase in are non-essential businesses that can't, by nature of their business, can't maintain that 6 feet of physical distancing. And one of the is if those businesses are the ones that I'm looking to reopen after I've looked at border measures and community surveillance, is that with appropriate personal protective equipment, with infection control measures, with appropriate workplace risk assessment, those are the ones, the last category of businesses that I would love to open. The first 2 that you talked about, non-essential, essential, if they're working, they can maintain physical distancing, they can go ahead. It's just that last category.
Thank you, Dr. Kandola. Follow-up question, Emily Cleveland. The line is yours.
Thank you very much, Mr. Chair. And Dr. Kandola, I appreciate that. It is the third category that I think I have most interest in, as do a lot of my constituents. So I appreciate that you're walking down that road and having that conversation with these business owners. My next question might be more appropriate for Mr. Cooper, but I'll let you guys decide that. But it's in regards to mental health. So we have seen a lot of communication from our constituents about how these orders are going to impact people's mental health across the territory. We have a lot of people who are self-isolating by themselves, they live alone. We've got people who are welcoming babies, and there is a higher rate of postpartum when you have no support. Maybe there might be single parents. We have teenagers who are no longer with their peer support or their support that they would find from teachers. And so we're in a situation where, although we're all in this together and we're all going through these orders together, the boats that we're traveling this journey in are not built the same. And so I'm wondering what the department is doing at the moment in order to change the way they're delivering mental health supports, and what mental health supports can we expect to see, given that this isn't a 2-month order. It isn't something that is going to be short term. We're going to see these orders coming down longer term. We're waiting for a vaccine, and so we're going to have quite the mental health journey associated with what's happening around the world right now. Thank you.
Thank you, Emily Cleveland. Dr. Kandola, line is yours.
I'm going to give it to Bruce Cooper.
Hi. It's on, Mr. Chair, I'll take it. So, so yes, the way that we deliver mental health services has shifted. Certainly the community mental health and addictions programming has moved to more virtual care and using telephone type services. Certainly, I don't have the demand numbers with me right now, but we know there's been a steady need and a continued need for this service. And I've heard actually that since we've moved to this virtual approach, that we've actually seen a significant diminishment of the wait list for these community services. We do, as part of our COVID communications and public awareness raising, we have been creating connections for people through our website. There's links there for people to connect with resources on mental health, and certainly through our work at the federal, provincial, territorial table, there's been some work done on apps, and including an app that people can connect with to connect with mental health resources to help them cope during what is for a lot of people a very stressful and isolated time. I don't know if Dr. Cook has anything she wants to add about closer to the clinical face of what is happening in the community, but maybe we could open the microphone.
Thank you, Dr. Cooper. Dr. Kandola, Dr. Cook, would you like to take that?
Sure, thank you. So as Bruce had just mentioned, the virtual care piece of this is really important, and it's something that we've expanded rapidly over the last few weeks. Now providing virtual care for both counseling, also for psychiatry. We have a psychiatrist who actually provided an entire clinic virtually from Ontario because she wasn't able to travel to the Northwest Territories. So opening up the opportunities for virtual care has been really a big step forward for the territory. I think it's important to make sure we all have the message that physical distancing doesn't need to mean social isolation, and that it's really important that we try to help people and support people in embracing ways of connecting socially at a distance, so connecting online and reaching out for those supports. So we're certainly doing that through our counseling programs, through our mental health supports, who are all really embracing virtual technology, but it's also important that we get that message out publicly as well, and trying to support people in finding those ways to connect. And just so I'm clear with people, in case they don't know what virtual care means, virtual care essentially means any kind of care that is not provided face-to-face. So there's a lot of care happening by phone, that's considered virtual, also by video. So we've enabled people to use consumer apps like FaceTime, Skype, Zoom, WhatsApp, that's considered virtual care. And we're also working on a secure messaging platform that will allow patients and providers to connect virtually as well.
Thank you, Dr. Cook. Dr. Kandola, would you like to add to that?
Cook and Bruce Cooper did an excellent job.
Thank you. And up next, I have me. I have a couple of questions. So through listening to everybody speak, again, I want to thank Dr. Kandola, Dr. Cook, and Mr. Tom for all the work that you've done. It's so relieving to see that all cases of all patients have recovered from COVID-19. Very encouraging, and getting ahead of this. But I did hear one key item mentioned, and heard it from the Prime Minister as well, and even from yourself today about talking about a vaccine. Have you been in touch with your federal counterparts and to see where this status is at for this vaccine? Has there been any improvement or any news that there will be a vaccine coming soon?
What we've heard is there's a lot of vaccine manufacturers, not just in Canada, but the US, globally looking at trying to develop a vaccine, but it's still 12 to 18 months away, because the one thing is when you do develop a vaccine, you have to do trials, you have to test it, you have to make sure it works, and above all, you can't push a vaccine that could cause harm to the population or could make things worse. And so what you'll see consistently is that we can't, if there's just no way we can rush through those steps, that they are going to take at minimum 12 to 18 months.
Okay, that's really good to know. Thank you, Dr. Kandola. My second part of my question is, and we talked. I heard some answers to it about easing of restrictions during this emergency declaration, and it sounds like it is dependent on the southern COVID numbers. So is that what I'm hearing, Dr. Kandola?
Absolutely correct, Emily Norton. The state of public health emergencies allowed, granted me additional powers to allow expedite licensing for physicians to authorize certain products, such as this hand-based sanitizer. It's allowed a number of enhanced powers, but the most important power that I have through renewing the state of public health emergency every 2 weeks are around border restrictions. And if our only risk to the NWT population around COVID introduction and transmission is travel related, and if we do not see a flattening of the curve for the rest of Canada, I would consider it unwise to lift travel restrictions at the border.
Okay, thank you, Dr. Kandola. Okay, with that, I understand that yourself and your staff and Minister Tom have another engagement at noon. So I want to thank you for your time and for all your work you've done. With that, you can sign off, and we will continue on with our meeting in camera. Mr. Stowe. Oh, and a reminder to the members, if you had any other questions, you could direct them to the minister. And just give me a moment here while I'm making some notes.